Welcome to our podcast where I, Keely Severson, Eric Johnson, and Alicia Swami are exposing mold. Today we have a very special guest, Dr. David Ross. Dr. Ross in 2001 founded the Virginia Institute of Neuropsychiatry, and he's also board certified in 3 areas: general psychiatry, neuropsychiatry, and brain injury medicine. Dr. Ross and his colleagues pioneered application of NeuroQuant in patients with traumatic brain injury. He invented a method for estimating brain volume the moment before injury to improve understanding of effects of brain injury on brain volume. Dr. Ross, thank you so much for joining us.
Keely, thank you and everybody for having me. It's a pleasure and an honor to be here. And congratulations to you all on your good work with the Exposing Mold podcast and getting the word out to people who are dealing with this illness, which can be terrible at times. And so I wanted to talk with you all today about what I do in this area as a neuropsychiatrist and with brain volume measurement. So I thought I'd show a few slides. And I think what I'll do, I'll make it about this big, and then I can see my screen to do other things too, which we want to do. And we'll talk a little bit about the neuropsychiatry of mold-related illness, then about how we measure brain volume with modern software techniques, NeuroQuant and NeuroGauge. And then we'll talk about how to apply the MRI brain volume measurement techniques to patients with mold-related illness. And as Keely, as you mentioned, a lot of people aren't very familiar with neuropsychiatry, et cetera. So I started out as a psychiatrist, and I was always most interested in the area between neurology and psychiatry, which is called neuropsychiatry, which is now a formal subspecialty area. And then later in my career, I also studied and worked a lot with patients who have various types of acquired brain injury, including traumatic brain injury. And you can think of mold, you can think of it as an acquired brain injury or toxic brain injury. And so the area I work the most in is the overlap of these areas right in here, mostly with traumatic brain injury, chronic, mild outpatients with traumatic brain injury, but also with patients with mold-related illness and other types of brain injury or neuropsychiatric disorders. Now, you all might know, and a lot of your listeners may know about the symptoms of mold-related illness and what causes it. So I'm just going to very briefly say, and actually let me add one thing as we go into this. I'm not what I would call a mold doctor. So I don't primarily diagnose mold-related illness. I rely on my colleagues who are expert in that to do the primary diagnosis. And then I add with the neuropsychiatric aspect or the brain volume measurement part. But I do know a fair amount about it, having worked with a lot of these patients and their doctors. And I know that it's caused by exposure to damp, moldy indoor environments that can give you a lot of medical symptoms and a lot of different organ systems of the body. There's immune system dysfunction, respiratory symptoms are very common. It can also affect neurological systems, including the brain, as well as other organ systems. In the brain, that is, neuropsychiatric symptoms include a wide variety of different kinds of cognitive impairment, like memory and concentration problems, fatigue and sleep problems, impaired balance or coordination, pain, and other neuropsychiatric symptoms. Now, we know that mold-related illness causes different kinds of brain imaging abnormalities, both functional, which means that imaging that shows the functional activity of the brain, as well as structural, like MRI or CT scans. And these have shown problems with blood flow in the brain of patients with mold-related illness and abnormal volume of multiple brain regions. And this is what we're going to focus on mostly today. So this is magnetic resonance imaging, or MRI, and this is what a scanner looks like. A lot of you may have had scans like this for one reason or another, but you lie on a table and you go back inside the scanner for for brain MRI, of course, your head and brain have to be inside there. And then this is an artist's picture of a cross-section. We call this axial cross-section of the head and brain. But this is what it looks like on an MRI image. We call it grayscale because it's colored different shades of gray. And we'll look at more MRI images in a minute. A more modern technique is to measure MRI brain volume. And the one we use a lot, well, one of the two we use a lot, is called NeuroQuant, which is amazing technology. It's FDA cleared as of 2006 to measure MRI brain volume in human subjects. And it's fully computer automated, which makes it very reliable. And it uses some high-powered rocket science technology that's been developed over really decades, and specifically with over $100 million in funding from the National Institute of Health. And that was up through about 2005. And since then, they've developed it further with private capital since the company went private. And it takes the grayscale MRI images like this, and then it does basic analyses, removes the surface, the skull and the meninges, which is the coverings around the brain, to look inside the brain. It also uses a method called inflation, which is a mathematical method that brings all the sulci from deep in their little grooves up toward the surface to make things easier to identify. And then it maps the person's brain to a common space like this. So these are different individuals, each with a little bit different brain, but they get mapped onto a common space, which is a type of brain atlas currently called a dynamic atlas. And then the process is reverse engineered so that each person's brain comes out with about 130 brain regions or subregions measured, the volumes measured. And the volume just means how big is it? And is it normal size, too big, or too small? It really boils down to that. So extremely sophisticated software that does it, what is ultimately a very simple thing. It's a fancy brain ruler, essentially. And it can take a grayscale MRI like this, and this the person's left side of their head and the right side. And then it turns it into one that looks like this, which colors the different brain regions different colors. And it will measure the volume of all these different regions, as well as multiple cortical gray matter regions, which are the red colored regions. And this is done in about, we send the images to the computer server, and in about 10 minutes, it gives us back the analyses with the colored brain images and the reports that we'll see in a minute. Very fast, which makes it practical and affordable. Unlike, 15 or 20 years ago, you basically couldn't do this in the clinic. And this will give you an idea of the many different regions that NeuroQuant measures on the surface of the brain. This is the left lateral surface. This is the medial surface. And if I show you my, I got my skull and brain model here, and it's a little easier to see in 3 dimensions. So if I take the brain out there, and if I hold it like this, actually, let me do it like this. This is the left side of the brain, and that's what you're seeing here, the lateral left side of the brain. And if I pull it apart in the middle, like this is what's called the medial surface of the brain. And you're looking there at the medial surface of the left hemisphere of the brain. So we get a very rich analyses of brain regions and subregions deeper in the brain. This is a picture of an actual brain postmortem, and then a picture of functional maps of the brain. And the different colors tell you different types of activity. The blue regions are hardwired, like the visual region, hardwired to visual space, and the motor region hardwired to what part of your body you're going to move, et cetera. But yellow or less hardwired, and the pink are the most abstract, the parts of the brain that do the most abstract types of thinking and integration of all the other sensory and motor aspects of your brain. So this is important for what we do, because we can take these regions that are identified by NeuroQuant And then we sometimes can associate them with certain symptoms the patient has. Not always, but often, which would provide confirmatory evidence that if we find volume abnormalities, that they're important for that patient. This is an example of our current favorite type of NeuroQuant report. There are several types. This one's called the triage brain atrophy report. And it's our favorite because it has the most brain regions. There's about 130 brain regions here by the time you get through all these regions, and then the left side, the right side, and the total, which is left plus right. And the regions colored blue are abnormally large. And this patient had a lot of abnormal enlargement. And I can zoom in there. The regions colored red are abnormally small, and he only had a couple of those. We're going to look at a patient example who had mold-related illness, and I'll get a little bit more into the details of this report. But these analyses are adjusted for intracranial volume, which is skull size, because people who are bigger have bigger heads and bigger skulls. And that's not really that important or interesting for what we're doing. What is important is how big is your brain relative to your skull size. NeuroQuant also adjusts for age because your brain volume changes as you get older. When you get very old, it starts shrinking, sadly. And it adjusts for sex. And the other type of software we'll talk about is NeuroGauge, which we developed here over the years. NeuroGauge is based on NeuroQuant, and whereas NeuroQuant measures the brain volume, NeuroGauge extends the utility of NeuroQuant in a few ways. And these are the ways NeuroQuant extends the utility of, NeuroGauge extends the utility of NeuroQuant. One is we measure asymmetry, how big is one brain region compared to its contralateral counterpart. And we measure longitudinal change over time. And we'll talk about these today a little bit. These other two methods, we'll save that for maybe another day. This is a patient with, by the way, I should have mentioned, this patient had chronic mild traumatic brain injury, but the pattern happens to look a fair amount like the mold pattern, except we don't see as much cerebral white matter atrophy. We usually don't see that with mold. We do see that a fair amount with traumatic brain injury. But interestingly, and it was somewhat surprising to me at first, a lot of this enlargement we see with both chronic TBI and chronic mold, which you don't see a lot of other than acquired brain injury. We'll see it with hypoxic brain injury. But other things, you don't see a lot of abnormal enlargement with dementia, Alzheimer's disease, chronic alcoholism, a whole lot of other things. They generally make your brain shrink. But these disorders, including mold, are a little bit different that way. This patient also happened to be chronic mild TBI, but she had very good asymmetry that clearly showed up. And you can think of this as the patient facing us, and that'd be her left ear and her right ear. And you can glance at this and see that the left lateral ventricle here is a lot bigger than the right. And the ventricle is filled with cerebrospinal fluid. So it's deep in the brain. Here it is in 3 dimensions. It's a cavity or a hole deep in the brain filled with cerebrospinal fluid. And its purpose is to take up extra space in the brain where there is no brain tissue. So if your brain tissue shrinks for some reason, your ventricles will get bigger to take up the extra space because something has to take up the extra space. It's not going to be air. It's not going to be a vacuum. It's going to be ventricles filled with cerebrospinal fluid, basically. And then when we look at the NeuroQuanted version of this, again, you see the ventricles now colored purple. They appear to have abnormal asymmetry. And the question is it truly abnormal? But you can also, you may see here, now it's easier to see, there's a gold colored structure here, much bigger on the right than left. In fact, it's so small on the left, you can barely see traces of it here. That happens to be called the hippocampus. It's very important for short-term memory and other aspects of memory. And interestingly, the radiologists who read this MRI, there are actually 2 or 3 that read her MRIs over about a year or 2 period. None of them said there was abnormal asymmetry, which is interesting. It's obviously looks asymmetric. The question is it really abnormally asymmetric? To answer that question, you need to measure a bunch of normal control subjects and then find the average, let's say ventricular asymmetry, what's the average? And then you need to find the standard deviation of that asymmetry for the lateral ventricle. Remember your bell curve and how wide or fat your bell curve is. That'll give you your standard deviation. And then you can compare your patient's asymmetry to the normal control groups to see if it falls above the 95th normative percentile, in which case it would be abnormally large asymmetry, or below the 95th percentile, in case it would be abnormal asymmetry in the opposite direction. That is, left bigger than right or right bigger than left. And that's what we do with NeuroGauge. And I'll show you an example of report in just a minute. But before we get into that, here's a couple papers we did a few years ago called our man versus machine papers. This happened to use chronic mild TBI patients because those are the main types of patients we have to study. But I can tell you, based on my experience with many other kinds of patients who have subtle brain volume abnormalities, including patients with mold-related illness, the same principles apply. And that is that NeuroQuant and NeuroGauge would found that volume abnormalities in 96% of the patients, but radiologists looking at the exact same MRIs said there were volume abnormalities only 13% of the time, a highly statistically significant difference. This is not a criticism of my radiology colleagues. This is just the limitation of the human brain and visual system for seeing volume abnormalities. If the volume abnormalities are big, like 20% bigger than normal, that's around the threshold for when you start to see the volume abnormalities. But when they're smaller, it's hard to impossible to see, and you need to measure them. Just like just about everything else we do in medicine and science, it's better to measure things for a lot of different reasons. And that's true, certainly true with brain volume. So what do we find in patients with mold-related illness? These are two studies from Dr. Shoemaker and Dr. McMahon and their group. And they found in patients with mold-related illness, there were multiple regions of abnormal enlargement, including forebrain parenchyma, which is basically the cerebrum. It's the big part of the brain that you might mainly think of when you think of the brain. It does not include the brainstem or the cerebellum. This part down here, which is a much smaller part, doesn't include that. Cerebral cortical gray matter, which is I think we met all of the surface regions of the brain here and on the medial surface as well. That's the cortical gray matter. Also large. All of these are large. None were small. Cerebellum, we'll talk about it in our patient example today. That's the little, it's a small part of the brain, relatively small, in the lower back part of the brain. Small but very important for coordinating movement and to some extent thought and emotion. The pallidus, which is a small nucleus deep inside the brain, it's in here. I'd have to stick that in about another centimeter to get deep in the brain to see the pallidum. We'll look at cross sections of that. And then amygdala and hippocampus, they're next to each other, and they're also kind of deep in the brain, down in here, another half centimeter in. And we'll look at cross sections of those structures. So that's kind of the pattern we expect based on the published literature. And so now we'll talk about our patient example. And this actually, this patient is someone you all know. This is Shelley Federico, and she gave me permission to use her name and to talk about her symptoms and her brain volume findings, which is very gracious of her, and I appreciate her doing that. And I also just want to say that she's been a grassroots leader and supporter of arguing and supporting people with mold-related illness, and I have a lot of respect for her. And so once again, she comes forth as a leader to let us look at her example that might help educate or maybe inspire some other patients dealing with this. Well, she was my patient around 2012, 2013. and 36 years old at the time. She had mold-related illness diagnosed by the mold doctor. And then we did the neuropsychiatric evaluation and found she had a lot of typical symptoms of mold, neuropsychiatric symptoms, and other things that often go along with it, including post-traumatic stress disorder, because it's such a terribly stressful experience, headaches, pain, gastrointestinal symptoms, respiratory symptoms, and some other somatic medical symptoms. Okay, so now I'm going to show you my computer across the hall, and I should be able to control it sitting here, and hopefully all the technology will withstand it. Looks like you guys can see that, right? The brain images. Yeah, it looks like it's working fine. So here we've got images. Let me show you. They look like this. You can see the front of her face, back of her head. And we reslice those in 3 planes of section using Asymmetry software. Whoops, I hit the wrong button. All right, let's try it again, sorry. Okay, I want that one. Move that down, that's better. And make that a little bit bigger. And so these are synced so that when I move one, these 2 lines here correspond to the other planes of section. And we go through here to make sure that the whole head, nose, top of the head, back of the head, and the ears too. And I'm looking over here, and you'll see her ears go through the images, that they're all in view. Because NeuroQuant likes that. It basically expects that because it starts taking off the skin and the scalp first, then it takes off the skull, etc. If it doesn't see all that, it can get a little confused. So that was good. We checked that. Then we send these images to the NeuroQuant computer server. And in about 10 minutes, it sends us back the colored brain images, which look like this. And we slice those in a couple of planes of section. Let's see. All right, there we go. And we look at all of the sections that include brain information. So again, that's her left eye, right eye, as if she's looking at us. And these are her frontal lobes, and there's good differentiation between cortical gray matter colored red and the white matter underlying it. Moving toward the back of the brain, that's the back of her eyeballs, moving toward the back of her head, although we're still in the front of her head. These are the temporal lobes coming into view down here. You start to see the lateral ventricles show up. We talked about those. And I'll make this a little bit bigger here. These are what we call subcortical nuclei. Down here, still in the temporal lobes there, still in the frontal lobes there. These are the amygdala, which are lower down. They're affected in mold. They get too big with mold. These are the pallidum, these small purple, blue-purple areas enlarged in mold. Now here comes the hippocampus, left and right, enlarged in mold, as well as a lot of this cortical gray matter area. A lot of that is enlarged with patients with mold-related illness. She had a little bit of asymmetry in the ventricles, you can see there. Was it abnormal? We've got to measure it and test that. Might be. Thalamus is generally enlarged in mold. I'm telling you generally what we see, and then when we get to her report, we'll find if hers are abnormal or not. This is the cerebellum in the lower back part of the brain. It's connected to the brainstem here. The brainstem is what connects the upper part of the brain to through the spinal cord down here to the body. Moving again toward the back of the brain. We're about halfway through the brain now. Then going toward the back, we still see the hippocampus. It's a long structure. Middle of the cerebellum. Now we're in parietal lobes here. As we get further in the back of the brain, heading into the occipital lobes, the back of the lateral ventricles, the very back of the cerebellum. And we look at all those and we look to see that everything's colored right. That is, that all the brain regions are identified correctly. With NeuroQuant 3.0, which we use now, they're almost always identified correctly, but maybe 1 or 2% of the time, there'll be some region not identified correctly, and then we won't use that region in any of our further analyses. And you should always check on that. Sometimes they'll set up the MRI scanner wrong. If they do that, then you got to get them to do it again. And we try very hard to make sure they do it right the first time, but sometimes they don't. We like going to centers we've trained who do it right over and over. And then when they press a button on their MRI scanner, it'll do, our protocol, and they usually do it right every time. This is just another way of looking at the brain. Axial sections, that's the left side of her body, the right. Imagine her lying on a table with her feet coming out of the screen toward us. Frontal lobes, occipital lobes in the back, lateral ventricles on each side, subcortical nuclei here. And we've seen all this here. This is just another way of looking at it. Hippocampus, and you can see how long they are. And then finally we get down into the brainstem and cerebellum as we come down closer to the bottom of her brain. Okay, so she passed all of our quality control. So then we took the NeuroQuant reports that came back, which will come back over here. And we've got, let me see. Yeah, I'll do this one now. And this is our favorite one, which I mentioned earlier, called the Triage Brain Atrophy Report. And so for Shelley, at this point in time, you can see there's a bunch of blue regions, just one red region. So there appears to be quite a bit of abnormal enlargement. That's the blue regions. And the next question is there more abnormal enlargement than you'd expect by chance alone? Because to be abnormally large, you have to be, the brain volume region has to be greater than the 95th normative percentile. That's bigger than 95 out of 100 normal people of your same age and sex. And so you can see all the numbers in blue, they're all 95 or bigger. Okay, so if that's true, think about it. By chance alone, any one brain region would have a 5% chance of being above the 95th percentile. By chance alone, or you could say that's what you'd expect for a typical normal person. So when you've got about 130 regions, if 5% of them are going to be abnormally large just in a typical normal, that's 5% of 130, that's half of 13, that's about 6.5. That's 6 or 7 regions. So you could have 6 or 7 regions that would be in a typical normal, but we've got here 3, 5, 8, 10, 11, 12, 13, 14. We've got about twice that many. This is a clearly abnormal pattern. This is not a typical normal. This is not a chance pattern. And plus, they're not distributed randomly. You've got 3 in a row here. It's all the same structure, cerebellar white matter. 2 in a row here, and this one came very close to being abnormally large. 3 in a row here. It's a very non-random pattern. This is a clearly abnormal pattern for multiple reasons. Now, the one red region, okay, that could be maybe normal because you could see that in a random normal person. That's possible. We'll have to maybe think more about that one. Okay, the next thing we think about is, does it match the pattern we know exists in mold-related illness? Because we know that's what she's got. She didn't have any other problem, basically, before exposure to the moldy military housing in this case. And the answer is yes, the cerebellar white matter and gray matter are enlarged. Remember, we talked about the previous published studies showed abnormally large cerebellum. That's a completely different set of patients and control group. And we see that here in Shelley. And I've seen that in many, many mold patients. I've had over 100 patients with mold-related illness we've done NeuroQuant evaluations on and NeuroGauge. And we see a cerebellar white matter enlargement in particular is probably the most common region I see of all. We don't see much cerebellar gray matter enlargement, to tell you the truth, but Shelley does happen to have that in this case. Then you get a lot of different cortical gray matter regions. Now, in Shoemaker's study and McMahon's study, They looked at this value right here, cortical gray matter. For Shelley, it's above average, but well within the normal range. But this cortical gray matter is composed of all of these smaller cortical gray matter regions, or I guess I should say subregions. And so a lot of blue here, that's all an important part of the cortical gray matter here. So in my mind, I think that's likely due to mold-related illness in Shelley because it's logical. We know in general this structure is big and these are part of that structure. And then furthermore, she doesn't have any other reason to explain it. It's not normal. She doesn't have any other brain disorder to explain it. Even PTSD, which is probably due at a different mechanism from the mold exposure, the psychological stress, et cetera. That has a very different pattern from this, mostly atrophy, by the way. And so that doesn't match that pattern. So that's part of the differential diagnosis of the volume findings that we do and that everyone should do when they're interpreting these findings. Okay, I think I'll minimize that. And I do want to mention one thing. NeuroQuant, whenever it does any volume analysis, it automatically sends you as a freebie this extra analysis here called the General Morphometry Report. And at first glance, it looks like it has a lot of useful information. There are multiple brain regions, left-sided volume, right-sided volume, and they actually measure asymmetry. But the limitation of this report is that there's no normal control data. There's no comparison of this data to any normal control group. So you can't tell if any of these data are normal or abnormal. So that leaves a lot to be desired. So there may be usefulness for this in other settings or maybe for research or things like that. But for a practicing physician trying to interpret the data, this is mostly not helpful for me. I really basically never use this for anything we do, and actually probably have never used it because we want to know first and foremost, are the brain regions, is the volume abnormal or not? And I do see this used sometimes in patients, and some doctors will say whether these are normal or not. I would not do that, and I'd be very cautious about that. All right, so that was what we call her time one NeuroQuant report. T1 means time one. And then we also did a NeuroGauge report on her time one analysis, which is this one. And this is our own software and our own report we created here. And I will make that a little bigger. And we'll go up here and show you some of the highlights of this. So in our typical report, and this is a typical example, you know, we say this is our NeuroGauge cross-sectional analysis. That means one point in time, and who referred the patient and date of MRI, et cetera. This is a summary of all the findings, which are multiple brain regions were abnormally large. There's a lot of asymmetry we'll look at below. And the summary is she had a clearly abnormal pattern of brain volumes that provided objective evidence supporting the diagnosis of mold-related illness. Objective is an important word. We'll come back to that in a few minutes. The radiologist interpreted this MRI as being completely unremarkable. That is basically normal. That's by far the most common sort of reading that we see. And I would have said the same thing if all I could do was look at the images with my question about ventricular asymmetry. We do quality control, looking at a lot of technical parameters and to make sure that all the images are good quality. And in her case, they're all good. Then we do our asymmetry analyses. We talked about, I can make that a little bigger. We take our different brain regions. We look at the left volume, right volume. And the asymmetry tells you how big is the left compared to the right as a percentage. And if it's, then we compare that to the normal control group. And if it's abnormal, it'll get a blue color. If right side's smaller than left, it's going to get a blue color. Actually, let me do that again. Well, the ventricles are tricky because, let me not get into the details too much. Let me just tell you that the colors mean abnormal volume, abnormal asymmetry. Okay, and we could get into details more if you want. But these happen to be ventricles, remember? Spaces in the brain filled with cerebrospinal fluid. Those ventricles, and we did see them kind of quickly passing through, they looked abnormal asymmetric, and this tells you that, yeah, they were 32%. So the left side was 32% smaller than the right side. And that was abnormal at the 2.57 normative percentile. That's around 3%. That's more asymmetric than 97 out of 100 normal people. And the other ventricles had abnormal asymmetry as well. The pink asymmetry is left smaller than right for brain tissue, and the blue is right smaller than left for brain tissue. And you see there's a lot more asymmetry here, a lot more than chance alone. And so I'll say at this point, we did not expect there to be, abnormal asymmetry in patients with mold-related illness. Because why would there? Because you would think the mold toxins or related toxins from water damaged buildings that get into your system, whether you breathe them, gets through your skin, mucous membranes, we think they would basically go into, sometimes they'd affect the surface directly like the lungs. But in terms of the brain, by the time it got to the brain, it has to go through your blood, basically. And so we figured it would go to both sides of the brain equally and probably have equal effects on both sides of the brain. But we saw patient after patient with a lot of abnormal asymmetry. I would say roughly 50 to 60% of our patients with mold-related illness have a lot of abnormal asymmetry. And then, another 30, 40% don't. So why do they have so much asymmetry? I don't know. One theory we have is that maybe some of them have a history of a traumatic brain injury way back when, and maybe it was subtle. Maybe they don't even remember it. Maybe it was, a sports concussion that cleared up in a day or two. Maybe they played head contact sports and never had a concussion. But multiple head hits can give you some damage to your brain and your blood-brain barrier, which covers your brain and protects your brain. I'm not sure, but with the TBI theory, that could make you susceptible to mold-related illness. And then years later, you move into a moldy home or workplace, and then the combination puts you over the threshold and you start getting the mold-related illness affecting your brain. That's just one theory, but we do see it. And here I just summarized the abnormal volume findings from NeuroQuant and NeuroGauge. We've already looked at the tables, so this is just a narrative report that helps me write the next part of the report. Then we do the interpretation about what it means, and we'll kind of skip on down to, and I've talked about some of this with you already. We talk about the abnormal asymmetry, and I talked to you about that. There were some anatomic correlations with abnormal enlargement of this region, for example, being associated with the abnormal asymmetry in the direction you would expect. We found 3 regions like that with abnormal enlargement from NeuroQuant triage report correlated with abnormal asymmetry from the NeuroGauge report. And you don't always get that, but sometimes you do. And then we discussed the findings with regard to the literature, the 2 published papers in mold-related illness. And I talked to you about that, about the cortical gray matter enlargement and the subregions that Shelley had. And then the cerebellum, and we really strongly think it's probably cerebellar white matter specifically that we can measure now. That cerebellar white matter, by the way, it's this is the cross section of the cerebellum, and the gray matter is on the surface, cerebellar gray matter, and then below that is the white matter. And it goes, and it's deep in there, so there's a lot more than you can see in this cross section. And it's especially that white matter in general, although Shelley did have involvement of both cerebellar gray and white matter. Differential diagnosis for volume for PTSD, we talk about that. And then we correlated the volume problems with a couple symptoms. For example, abnormally large volume of left inferior. Where'd my other half of my brain go? Don't want to lose track of your brain. Left inferior frontal gyrus, which is right along here, and that correlated with trouble with word finding ability, because there's an important part of your brain here, Broca's area, that allows you to produce speech. And then there was also abnormal volume of the same region correlated with executive dysfunction, because a lot of your dorsolateral prefrontal cortex is important for executive function, solving problems and making decisions. And we got a couple references there. We'll often include references, and then the occipital region, medial occipital region. So that's back here, medial occipital region. That's all visual areas, and that correlated with some of the visual symptoms that she had. And then we list our references at the bottom. So there you go. That's a typical time 1 report. And then we'll go to the time 1 time 2 report. And feel free to ask me questions if you want, but hopefully this is a good level of detail to get into. I guess so. Okay, we'll keep going. And I think I opened up an easier folder. Yeah, this might be a little quicker.
I did have a question for you while you're navigating, Dr. Ross.
Sure.
We had a fungal geneticist on a while ago, and she talked about how inhalational mycotoxins don't really do much damage to the body. I believe it was. Please correct me if I'm wrong, Eric or Keely. But where these brain injuries, how are they happening? Is it dermal? Is it people are eating these mold or mycotoxins? People are inhaling it? Like, what is causing the damage to the brain?
Well, I don't know. I'll speculate a little bit with the caveat, like I said earlier, that I'm not a mold doctor. But from what I've read and learned from my colleagues about that, there are different kind of toxins that can get into your body from mold or other microorganisms associated with water damage environments. I have heard some doctors say that there can be basically infectious type causes, even chronic infectious type causes in the body. I've heard other doctors dispute that. Then there are a lot of doctors who think there are immune system problems. So maybe you had an infection and then you fought off the infection, but your immune system was adversely affected, and that's what propagates the symptoms. It's because your immune system's not working correctly now. So, and I don't know the answers to those, but in either case, there's something that gets into the brain, whether it's, and could be, my leading guess would be some immune-related problem. There's probably some problem with the blood-brain barrier. And so again, the blood-brain barrier I mentioned briefly earlier, your little blood vessels, your blood vessels that go into the brain, they branch off smaller and smaller, and the arteries eventually turn into capillaries, which are the smallest blood vessels in your brain or body. And those capillaries, then that's what touches the brain tissue. That's the final step. And in between the capillary blood vessel wall and your brain tissue, there's an extra layer in there formed by the capillaries that creates the blood-brain barrier. The brain is the only organ in the body that has this special barrier. The brain is specially protected, unlike any other organ in the body. There's a lot of things in your blood that don't cause any problem in your body, but they are not allowed in the brain. And if they get into the brain, they cause irritation and inflammation. And so if your blood-brain barrier is injured for some reason, or if there's something to do with the mold or the immune response to the mold that injures the blood-brain barrier, then it all gets into the brain and it starts causing brain problems. And the enlargement. And the enlargement, again, we see only enlargement in mold-related illness, basically, to my knowledge. And maybe with very, very chronic patients whom I pretty much never see, it might be different. could possibly be atrophy in those cases. That's very speculative. But with the ones I see, 6 months or a year or 2 or 3 after injury, we pretty much see enlargement. We don't even know what would cause enlargement, but it could be chronic neuroinflammation, which goes along with the inflammatory ideas I was talking about. But we have another idea, especially from our work with traumatic brain injury, that there could be compensatory hypertrophy, which means, and that's what I hypothesize that may occur with the cerebellum, which we also see enlarged cerebellar white matter in chronic TBI, interestingly. And so the theory with compensatory hypertrophy is that when other brain regions are injured and not working as well, that you may have less injured regions working harder to try to compensate. And we generally know that can happen in the brain. We also know that when certain brain regions work harder, they get bigger. Their volume gets bigger. For example, if professional piano players, they have bigger hand regions on their primary motor cortex than average normal people. And professional taxi cab drivers, when they memorize the roads around London, the parts of their brain that memorize it get bigger. When they quit working, those brain regions will shrink back down, amazingly enough. So compensatory hypertrophy is another possibility. And that's a long, fancy way of saying I don't know the answer to your question. There's a lot of opportunity for research there.
I was wondering if the pattern of enlargement that you see looks like a precursor to empty cella syndrome or Chiari malformation.
Not that I know of. You know, empty cella syndrome, where you have, let me see which half of the brain I want. That's your pituitary gland right there. It looks like a little teeny bean. Hopefully I don't knock it off. But if you can see the very tip, that little brown bean looking thing that hangs down from the hypothalamus, and it sits in a little cradle, a bony cradle called the sella turcica, from the root words meaning Turkish saddle. Anyway, and sometimes it's empty or partially empty. The pituitary doesn't sit down in there all the way. My memory of that, this is kind of getting on the edge of what I do, and radiologists do this stuff more than me, and endocrinologists, but about half the time that's just a normal variation, but a lot of time it can be important. As far as I know, that wouldn't affect your brain volume. That's such a small little area. In terms of brain volume, that wouldn't have any effect on any of the brain volumes that we're measuring here, which are all of them are a lot bigger than that. And we don't measure that little teeny area down there with NeuroQuant. And let's see, the other one you mentioned, Chiari malformation. That's when your cerebellum, speaking of cerebellum, back here, there's a hole in the bottom of your skull called the foramen magnum, big hole. And your spinal cord, you can see at the very edge of your spinal cord here, it goes down through that hole, and that you could draw a line there. And the spinal cord's down here and the brain's up here. But sometimes the tip of that cerebellum will poke down through that foramen magnum. You know, not such a good thing. If it just pokes down a little bit, it doesn't cause any problem. But if it pokes down too much, it can cause quite a problem. And so there are different stages of severity of the so-called Chiari malformation. That could possibly affect the measurement of volume of the cerebellum. But that's something a radiologist would pick up. They would see that. And so we would look for that on the radiologist's interpretation. So I always look at the radiologist's interpretation. They can see a lot of things that NeuroQuant doesn't see or measure. You know, there's a lot more to brain structure than volume. Hopefully that gives you some idea on that. And then I'll go on to the longitudinal analysis. So we did a second MRI on Shelley. This was about a year later. Well, actually, let me take that back. Her first one actually was done December 2011. There's a technical problem with labeling the date, because the date we did the NeuroQuant got confused with the date of the MRI. Her first one was December 2011. The second one was in December 2012. And I will just show you probably just the triage for that. And we'll do this one a lot quicker than the first one because we already did the first one. And it's generally similar pattern. You can see similar brain regions enlarged, although they're not all exactly the same. But what we really want to know is, did the volume change from time 1 to time 2 over the year period? And to do that, you can't just look at these, let me see, this is her, where's her first one? We'll close that for now. I don't need that again. Why do I have 3 down here? Sorry, got too many copies going on there. This was her time 1 that we looked at. And then this is her time 2 that we're looking at. And what you can't do is just eyeball these and decide if something changed volume abnormally fast from time 1 to time 2. Let's say like anterior cingulate on the right. It's not abnormally large there, although it's kind of big. It is abnormally large here. Does that mean it enlarged abnormally fast? Not necessarily. You've got to look at, you got to compare that change in her to the change in a normal control group with the mean and standard deviation of the normal control group calculated. You'll see a pattern here. We do that with asymmetry. We do it with longitudinal change with our NeuroGauge. So that's what we did with our NeuroGauge software. And then I'll show you that report. And we do 2 types of longitudinal reports for technical reasons. If you want to ask me why we do more about that, I can tell you. But basically, because our normal controls are relatively old, with this analysis, we compare her to our older normal controls, and we can only look for abnormally fast shrinking of the brain. We can't look at abnormally fast enlargement of the brain because the controls are older, and your brain shrinks normally when you get older. She didn't have any abnormalities all the way through here. So this means she didn't have abnormally fast shrinking of the brain to the extent we're able to test it, which is good. You don't want to have abnormally fast shrinking of your brain. We then did a second type of analysis where we were able to adjust the normal control data using essentially the NeuroQuant normal control data, which is age adjusted, along with our own NeuroGauge data to estimate the standard deviation. And you need that as well. And here we have less brain regions, but we can look at abnormally fast enlargement or abnormally fast shrinking, also called atrophy. Now you can see multiple regions in green that enlarged abnormally fast over time. This is whole brain, so that's all of your brain tissue. Cortical gray matter got large abnormally fast. Remember, that's one of the regions in the 2 published studies, so there it is longitudinally. And this is a major component of whole brain, by the way. The third ventricle got smaller, probably because the tissue around it was getting bigger, although that didn't quite reach significance there. We got a couple cortical gyral subregions that got bigger. These are part of this region, and that covers it. And so that's an abnormally high number of regions, more than you'd expect in a typical normal person. And so, you know, they give us objective evidence that there's continuing enlargement that was matched the pattern known to occur with mold-related illness. And it also, you know, raised some concerns that there's still actively ongoing brain volume changes. We like to measure brain volume in our patients over time, every year, every few years, until it stabilizes and is not changing abnormally fast anymore. That way you have a new baseline measure of your brain volume. In case anything happens in the future, you could then compare from before to after. Okay, so that's our patient example as I wind down here. And let's see. And so then to kind of summarize and talk about a couple practical issues, The value of measuring brain volume in our patients with mold-related illness and our other patients is that it provides objective evidence of illness or injury. Objective means you can't exaggerate or fake it. In contrast, subjective, you could possibly exaggerate or fake, because it's based on a patient's report or the family's report. Like, I don't remember things as well. I have pain, I have headaches, I can't sleep at night, or I'm depressed. These are essentially subjective. They're based on someone's report. And unfortunately, a lot of times our patients, people don't believe them. Sometimes their only family members are not sure are they really telling the truth. Sometimes their own doctor doesn't believe they're telling the truth. Sometimes, they're going for a disability evaluation, which is very important. And people evaluate them are skeptical, like, show us proof. Well, I grew up in psychiatry. Almost everything we did was based on subjective report. There are almost no blood tests or lab tests or brain scans to diagnose general psychiatric disorders. So I'm used to that. I'm comfortable with that. But other people want objective evidence. Okay, we try to get it. And now we have it with brain volume measurement. It's a great way to get objective evidence. If any skeptic took the same MRIs I just showed you today on Shelley, did NeuroQuant analyses or NeuroGauge analyses, they will get exactly the same results back. And they're going to be abnormal, clearly abnormal. So that provides vindication for our patients. That our patients are telling the truth. And that can be very important for a lot of reasons. And then sometimes it can enhance compliance with treatment, because patients say, well, how can I keep my brain volume from getting worse, or how can I help it get normal? By the way, that McNairn study we showed you on mold and brain volume, when patients were treated, their brain volume tended to get normalized. It tended to shrink back down toward normal values. So there is good hope there. But beyond that, I'll say that the volume measurement doesn't really change treatment or rehabilitation. I would still recommend the same medications or rehabilitation therapies from my point of view, at least as a brain doctor. And finally, some practical issues. A patient who wants to get their brain volume measured can go to their local MRI center. They got to set up the MRI scanner exactly right. We tell them how to do it. It's not really hard. They just have to know that they need to do it and do it exactly this way. And then they get the brain images, which is all done locally, wherever you live in the country or even outside of the country. A lot of other countries do this. Then you can send them to us here in the Richmond, Virginia area, where we can do the NeuroQuant analyses and the NeuroGauge analyses and reports. So to just do the NeuroQuant and NeuroGauge work, the patient doesn't have to travel here to Virginia, not necessarily. Sometimes they do if they want me to do a fuller evaluation, et cetera, but we can do just the volume analyses without them having to travel here. And so to finish up, mold-related illness causes neuropsychiatric symptoms and abnormal brain volume. These volume abnormalities can be readily detected with our brain volume measurement techniques in the clinic. They're practical for use. And they can often provide objective evidence supporting the diagnosis of mold-related illness. So I'll stop there and see if y'all have any questions or comments.
Yeah, so just to confirm, are you the only physician in the nation utilizing NeuroGauge?
We're the only ones that actually do the NeuroGauge, and one day we might, license it out or something. We're not doing that yet, but we have other physicians who refer patients to us. Then we do the NeuroGauge analyses, and then we'll send the results to the patient's doctor, and they can discuss it with the patient. We can join the patient and their doctor and discuss it with them if they like.
Fantastic. And maybe I should have asked this question before that one, but could you tell us maybe a little bit about the mechanisms behind NeuroGauge?
Yeah, we have our own normal control group with 80 normals, 40 men and 40 women. They're relatively old, which is a limitation. So they range range in age from 60 to 72. And we combine that with, in some cases, with some analyses, with the NeuroQuant normal control database. The NeuroQuant database has 4,000 normal controls throughout the lifespan. And so, for example, with the asymmetry analyses, we use our normal control group. For a female patient like Shelley, for example, we compare her to our 40 normal women. And with asymmetry, there doesn't seem to be changes with asymmetry as you get up through your 60s and early 70s, probably because both sides of your brain atrophy due to aging at the same time, because both sides of your brain age at the same rate. And then for the longitudinal analyses that we do with NeuroGauge, we talked about, we do two types. In one type, we use our normal controls and only look at atrophy. And the other longitudinal analysis, we combine our normals with the NeuroQuant normals, best of both worlds, where we can look at abnormal enlargement or atrophy, and they're age adjusted. And so basically the theme, which I mentioned a couple times, what we do, we take our normals and you measure any given brain structure, like hippocampus, and you'll get a bell curve. Most people are near the middle, some are out on the tail ends. And you calculate the mean, which is the center of the bell curve. Then you calculate the standard deviation, which is the width of the bell curve. And that's the critically important information to determine your cutoffs at the 5th and 95th percentiles. For example, the 5th percentile is 1.64 standard deviations below the mean. And that number we put into our algorithms, which are mostly done in a series of Excel spreadsheets that takes the volume data and processes it and compares it to the normals. And it outputs at the other end the table of the results that we put in our Word report to create our reports. So that's how we do it.
Are you seeing any striking differences between mold-related illness and post-viral fatigue syndromes?
I don't know. I've done very few post-viral fatigue syndromes, and it's been years since I've done any. I'd be very interested in doing that. And so I don't know the answer to that, Eric. I'm sorry.
Thank you.
Now, when patients come to see you, do they often report like adverse psychiatric behaviors like personality change, depression, anxiety? Do you find the people that report these different symptoms, do you find that they're like exuding like, I don't know what I'm trying to say, sorry. Are you finding that they are showing up as having a brain injury, I guess you can say?
And are you talking about patients with mold-related illness?
Yeah, so you've characterized a patient as mold illness. They have XYZ symptoms, but I'm just taking it a step further. Do these patients usually report like personality changes, anxiety, depression, suicidal thoughts? And does that reflect within their brain scans as that they actually do have a traumatic brain injury that can be contributing to these different adverse psychiatric behaviors and feelings?
Okay. You know, of my patients with mold-related illness, and we ask them, when we do the entire, a full evaluation, so we do mainly three things. One is a regular clinical evaluation. We spend all day with the initial patient, look at all the records, interview them, test them, examine them. Then we do forensic evaluations, people involved with lawsuits, sometimes on our own patients. Then we do the brain volume measurement, sometimes on our own patients, sometimes on other patients who just come here just for that. That's what we do. If I do the full evaluation, whether it's clinical or forensic, and I'll have rich data, then as part of that, we always take a pretty careful history for a history of traumatic brain injury. Because otherwise, most other doctors, they don't, to tell you the truth, for various reasons. Not a criticism, it's for some good reasons. You can't do everything, et cetera. But hey, you know, I'm a brain injury doctor, so that's what we do. And in doing that with our patients with mold-related illness, I'd say about maybe a third of them have a history of traumatic brain injury. Yeah, maybe 25% to a third. But most of them don't, but some of them do. So in ones with a lot of asymmetry that we were talking about, and I was, hypothesizing possible relationship to history of TBI, traumatic brain injury. A lot of those will have a history of TBI, but a lot of them won't. So I'm not sure how it all connects together right now. Did that answer the main part of your question?
Yeah, in a way. I was just curious to see how many patients that you serve that, have been characterized as mold illness actually have major psychiatric issues like anxiety, depression, suicide, psychosomatic, like bipolar, just weird, interesting, psychiatric behaviors. Because I remember when I was going through my mold illness, and I know Keely can also back me up on this, I had a lot of weird suicidal thoughts, and I was always depressed or anxious. And that's usually not who I am as a person. I'm very optimistic and fun and loving and whatever. But I felt like when I was in the thick of my exposure, my brain just went haywire, and my emotions and everything along with it too. So.
Oh yeah, absolutely. And I'm gonna stop that share so I can see all bigger on my screen. Yeah, the patients that come to us with mold-related illness, they all have multiple psychiatric or neuropsychiatric symptoms or syndromes. If they didn't, they wouldn't be coming to a neuropsychiatry clinic, right? So it's not a random sample by a long shot. From what I read and understand in general, about half of patients with mold-related illness will have a lot of neuropsychiatric or brain problems. So what you experience, Alicia, is very common. I see that all the time, and it's a lot of brain symptoms usually, not just a couple.